Hey guys, my name is Ahmed. I work as an internal medicine resident, and I want to talk about a topic that's really irritating for me. I want to speak about hyponatremia. So, hyponatremia is confusing in the sense that there is a long algorithm on UpToDate. Oof. And going through this is just hell on earth. There's a simpler version of an algorithm on American College of Physicians site, MKSAP. And I like it because it's quite simple. I'm gonna work through this question. This is a 48-year-old woman, is evaluated in the ER for one-day history of hearing voices. She has history of bipolar disorder. Medications is lithium and quetiapine. Physical examination, she's disheveled and chronically ill. She's alert, oriented, but appears anxious. Blood pressure 138/78, pulse rate is 80. But there's no orthostatic changes, there's no edema. So we have her labs of blood urine nitrogen is 6 milligram per deciliter. Creatinine is 0.9. Electrolytes, their sodium is low, it's 126. Potassium is 3.5. Chloride 94. Bicarbonate 26. Glucose 156. So you're kind of getting the idea. So this is a question that is addressing hyponatremia. What you want to do first, which is not mentioned here, is in the UpToDate algorithm, is see if there's hyperglycemia. So her blood sugars have been on the higher side. So what you can do is you can use this formula, correct her sodium. So if you want to correct her sodium, you can measure the measured sodium. You use the glucose minus 100 times 0.016. I would like to use the app. I think the number is 126 and her glucose is 8.7. You would get a value of 127. Simple. And then, here we go. The calculated sodium is 127. So you confirm that it's hyponatremia. Then the next thing is you need to know her serum osmolality. Serum osmolality is, again, there's another formula for that. It's 2 times sodium, glucose, serum urea. You can use it, or you can also use the app again, MedCalc app. It's very easy. You can just use it on iOS. What you do is look for serum osmolarity. It's osmolality here. You type in the numbers 126, BN is 6, her glucose is 8.7. They didn't give you an ethanol number, so her osmolality is 263, which is low. So you follow this algorithm. So isotonic will give you will lead you to another way, and high to find the volumic state of the patient. So we need to find if she's dry or she's avolemic. She did not lose any water. She's well hydrated, or she's hypovolemic. Is she a fluid? Is she retaining any fluids? Is she fluid overloaded? So we need to see that. When the question, they didn't really mention. So they mentioned that she has no orthostatic changes and there's no edema. So it's kind of implying that it's isovolemic. Now the next step is to look at the urine osmolality. The urine osmolality is 96 milliosmol per kg water. So it's here, if it's less than 100, it's excessive water intake. If it's more than 100, it's SIADH. So it's less than 100, so suggesting excessive water intake. So the reason we try to calculate the serum osmolality is because if it's actually high, as you see here, if it's high, then it's hypertonic hyponatremia. We need to assess for hyperglycemia, the thing that we did in the beginning. We check for the patient received mannitol or sorbitol, recent administration of radiocontrast media. If it's normal, that's isotonic hyponatremia, then it's pseudohyponatremia. Then you assess if the patient had like hyperproteinuria or hyperlipidemia. Hyperproteinuria can happen in like plasma cell dyscrasias like multiple myeloma, or like someone has a really abnormal lipid panel.